So Dr. Kaplan, thank you so much for meeting with us. As you know, this is our 5th year driving for Men's Health.
Congratulations.
Thank you. And the problem has been in the past 5 years that we're still not getting the momentum. We're still not able to get all the guys into the doctor's offices because they're kind of afraid to come see us. Why do you think that is?
Yeah, so I actually see it all the time, right? My wife sent me here is the main line I get when men come to the office. They never take the initiative to go and see the doctor. And I think a lot of the reason why that is because they just are afraid of what they're going to find. Men think they're invincible. Men are the head of the household, right? They try to lead the family. And for them to fall ill or get sick or be diagnosed with something would be really detrimental to them, detrimental to the household. And so they almost avoid the doctor out of fear. Mm-hmm. I see it a lot.
So is it really scary coming to see you for the first time? Because you usually are the gateway. So when we say go see your doctor, we're like, go see someone like you first.
I'm the guy they're going to see. I'm the most unintimidating person you could ever meet. And so I think that's really important. So getting the patients into the office is really important. When they come to see the doctor, they have to know it's not going to be something stressful. We're not pulling teeth. We're not doing crazy invasive procedures
Not
here.
everyone gets a prostate exam when they come in.
Not to me. That's your job. But the thing is that once they get here, making them comfortable with the environment, right, with your staff, with the physicians and the providers, I think that's key to getting them comfortable opening up, having the patients tell the providers what's wrong with them, and getting them care they need.
So what if something is not wrong with them? What is the benefit to seeing someone like you at least once a year?
Right. So according to the United States Preventive Task Force, there are screenings that should be done just to kind of check you to make sure that you're healthy for your age. Mm-hmm. And that would include just baseline blood work, a good physical exam, getting your vital signs checked, make sure your blood pressure is okay, and then, just kind of just talking about where your mental state is, right? Because, in these days and age, a lot of emotional instability, I should say, depression, stress at work, and just kind of talking about things, taking a general account of how your health is and what's going on.
Yeah. So you mentioned lab work.
Yeah.
A lot of young guys come to see me and all they want is their testosterone checked. But there's some lab work that is a lot more important than that. What is it?
So my general panel is just electrolytes, kidney function, liver function, making sure their cholesterol panel is nice, checking their blood counts just to make sure there's no bloodborne illnesses going on. I tend to throw in a thyroid function panel, vitamin D, and then, of course, the PSA if you're over the age 50 in general practice. Mm-hmm. We have a conversation about whether or not to check for that. Mm-hmm. And then screening patients to see what kind of problems they have. We can check their testosterone. Women will generally get, a pap smear done on their general physical exam with either the gynecologist or with one of the providers here. And that's really about it.
And in terms of screening, like can it be too soon? Can a 20-year-old guy come in and say, hey, I want to get screened? Or when is the right time that a guy should start thinking about, hey, I should go see a doc?
So in general, the task force, the preventative task force, sets guidelines of when patients should come in. Usually from 18 to 30, every 2 to 5 years is a good time to come in. After the age 30, generally 1 to 2 years. Mm-hmm. And screenings really can begin at the age of 18 when you're sexually active. Some of the Preventive Task Force screening guidelines include sexual transmitted diseases, and so you should get screened for that. And part of your physical, when you come to see your doctor, is also to be screened for those things. Yeah. So it's always good. And not to mention your vaccines, right? Vaccines is a very important thing. So if you're not getting your flu shot yearly, right, as part of your annual physical, if you come in the fall to early spring, right, you should be getting your vaccines as needed.
Mm-hmm. Now there is a vaccine. There's one vaccine that prevents STDs. How important is getting that one, and what is it exactly for?
So are you referring to the HPV vaccine?
Yes.
Right. So the newest guideline, from my understanding, is that all young adults, right, from early age 12 up to 25 should be getting the HPV vaccine, both men and women, actually. Mm-hmm. Important for both to get it.
Yeah. It is important because as a urologist, I do see some repercussions of that. I mean, we may see some lesions, but then that can also lead to some cancers, and it's the same in women as well.
Absolutely.
So it's important to get not only the vaccines, but all your preventative screenings.
Protect yourself and your partner.
Yeah, that's good. So in terms of screenings, one thing, obviously guys for us always worry about prostate exams and PSA screening. The other thing they always worry about is colonoscopies. Now, can 30-year-olds get colonoscopies, or when is the right age to start?
Well, so the answer to that is it depends, right? Like all things in medicine. It depends. Do they have a family risk of colon cancer, right? Are they at higher risk than general population? In fact, I think just yesterday, right, the American Cancer Society gave a new recommendation that colonoscopy should start at age 45.
Yeah.
So, you know, it depends on your risk. It depends what guidelines you're going by. There are multiple ways to check for colon cancer, though, right? You can do an in-office fecal occult blood test, which is kind of on the lower end of sensitivity and specificity, or probability of actually picking up the cancer. The second test that I actually have been referring to a lot now and recommending for patients is called Cologuard, right? It's a great test. I order it, they send a box to your house, you put the sample in the box, you send the box back to the lab, and somebody opens that box and boom, test you for cancer. It's very easy, and the sensitivity on that, or the probability of something being found, is at 92%. It's actually really good. And then, of course, the gold standard is colonoscopy. If we were to have this conversation a week ago, I would say general population would be screened at age 50. Depending on your risk factors, African American, higher risk, maybe 45, even down to 40. Usually it's 10 years before colon cancer was actually found in one of your a close first-degree relatives.
And this is the thing, is you have to go and see someone like you to
Sure.
get that information, because if you go online, there's so much information out there that you may not get the right information that's the most up-to-date. So it's always important to go see someone that's a specialist, or someone that actually keeps up to date on the medicine, and your best friend is going to be someone like
and
you.
that's exactly the thing. I mean, I always say, you know, it's good to see your doctor, but it's also just check in with your friend, right?
Yeah.
Your doctor should be your friend that you're going to have a conversation with, that you're going to have a discussion about what you're going to do next. I mean, you don't want to meet somebody for the first time when you're diagnosed with some terrible disease, and then have that person who you just met 5 minutes ago talk to you about what the rest of your life is going to be. I mean, you want to set up a relationship, have continuity of care with that person, and really have rapport with your physician to kind of make good decisions throughout your life.
Yeah. So there's going to be a lot of guys making appointments with you and
I hope so.
primary care doctors after this, which we hope they
That's
will do.
Absolutely important.
But before they can get in to see us, if you had 3 tips for guys out there, what can they start changing in their life right now after watching our conversation on how to improve their health overall?
Right. So first thing, go see your doctor at least once a year. Let's start with that. Get your vital signs checked, maybe some baseline lab work. Second thing, I can't emphasize this enough, start eating healthy. And, you know, if you don't know what that means, talk to somebody that does. Maybe your doctor, maybe a nutritionist or dietitian, but get involved with eating healthy. And then lastly, stay active, right? Always stay active. And, you know, I would say a fourth thing on here is good sleep and good emotional status as well. I mean, those are the keys to a successful, healthy lifestyle in all things. And ideally, when you do come see me and you're doing all those things, it'll be, hi, how are you? Everything looks good. We'll see you next year.
And a high-five handshake.
That's what we want.
Well, thank you, Dr. Kaplan. Appreciate your time, man.
My name is Dr. Ben Kaplan, and it's time to drive for men's health.